Hi, I'm Dr. Mo from Spark Sports Medicine and Concussion Center, and I'm going to cover the return to learn component of concussion management. This is something that has been somewhat neglected in terms of care, and even in the literature. If we go back 10 years, even further, we've been doing return to play guidelines for a long time, but we really haven't been thinking about the student athlete in the classroom. The focus has really been on the field. So, the research has really come along. The fifth consensus has really supported the importance of a return to learn protocol. And what that is recognizing that whether you have a student athlete or just a student or someone in the workforce, that concussion can affect cognitive and oculomotor functions, and as a result, you're not going to be able to think the same way when you have a test. You're not going to be able to sit in front of the computer and tolerate oculomotor function the way you did, or you're going to run into ocular fatigue much earlier, etc., etc. So really, with return to learn, we try to implement this as early as possible. When we see someone come in, even the day of or the next 2 days after, or that first week even after a concussion, one of the first things we do is assess what is the level of cognitive symptoms along with the rest of the symptoms. And we do have the capacity to do cognitive testing. We have relatively quick and easy 20-minute computerized cognitive tests that give us really good information and break down the different cognitive composites, be it verbal memory, visual memory, processing speed, attention, cognitive efficiency, reaction time. Those are all the different composites we're looking at, and ultimately taking the specific deficits that a particular patient might have and then putting together a plan of accommodations, instructional strategies, work accommodations, whatever it might be, that's individualized for them. And that's what we refer to as the ICAP, or the Individualized Cognitive Action Plan. And that ICAP can change week to week depending on the progression of the person recovering, or it can not change because there are some head injuries where they have very severe cognitive symptoms for a long time. So we generally do take a look at it at least every 2 to 3 weeks and see where they're at. We may consider repeat cognitive testing every 2 to 3 weeks and see if we can get folks going from sort of what we call the red zone, which is really severe cognitive symptoms, progressing through orange, yellow, ultimately getting to the green, and then the blue zone. The red zone is usually when you sort of need absolute cognitive rest. You're staying home from work or school. The orange zone is where you could sort of do a few hours, half time, usually with a ton of accommodations, no tests, reduced work, etc. Yellow zone, you're starting to transition closer at half to full time. You may do testing, but with accommodations, in other words, extended time or untimed tests, and only one a day. And then from there, we can transition to the green zone, which is a good place to be. That's usually when you're basically going back to full time and transitioning back to full workload so that you don't sort of jump in all at once. And then the blue zone is basically when you're fully back to work or school, and in the case of our student athletes, ultimately also back to their sports. So that's how we go about with the return to learn. Color zones, or the stages, has really become a critical piece of concussion management anywhere across the spectrum of recovery. So.